This is the story of Maria from Spain. She suffers from a disorder of the lymphatic system, elephantiasis, which is the term used to describe the most severe form of lymphoedema. While I was at communion, I noticed that my shoes were rubbing. Then it spread to my knee and has gradually worsened over time. The doctors in Spain can't help Maria. The young woman is therefore suffering greatly with her chronic disease. She has been confined to bed for 10 long years, until the Spanish branch of the Bayreuth compression stocking company Medi heard of her plight. In 1999, with the support of Medi, she had her first visit to the Lympho-Opt clinic in Hohenstadt. She had a consultation with Dr. Shingale, the lymph expert, who offers the correct treatment for her at last. At this time, the circumference of her lower leg is 1 meter 59 centimeters. In the first 6 months of treatment, she lost around 70 kilograms in weight and could walk again. Back in her home country, Maria rigorously followed her plan. Today, Maria's condition has really improved. She was here for the last time in 2006, and she has managed fantastically since then. When you consider that at home she has no access to manual lymphatic drainage and that she's had to treat herself, apply her own bandages, compression stockings, and intermittent pneumatic compression, that's a fantastic result. In 2014, Maria has attended the Lympho-Opt clinic for the 4th time. Dr. Shingale is her trusted physician. Together with the therapists and the medical supplies retailer, a detailed plan is developed for Maria's stay. This time, the aim is to reduce the edema even further, particularly in the thigh. Manual lymphatic drainage is not available to her in Spain, so this treatment, which is important for tissue decongestion, is essential. I always like to explain it by saying it's as though I were trying to press yogurt through a sieve. It has a similar consistency, and I try to stir it round until it's soft and then press it through a very fine sieve. I try to loosen these protein adhesions in order to improve the drainage. The next appointment follows on immediately from the manual lymphatic drainage. The legs have to be bandaged. The bandage prevents reflux of the lymph into the legs and further stimulates the lymph drainage. The patient's cooperation is particularly important here. At home, Maria performs this procedure on her own every day. It is arduous. On this occasion, as an alternative to the laborious wrapping after decongestion, Maria is going to try out something new. My idea is that we will work here very specifically with a new product, Cirque JuxtaFit, to make it a bit easier for her at home. It's a compression bandage with adhesive closures supplied by Medi that she can put on herself. And I hope that in this way we'll really be able to get it under control. Maria is still used to bandaging herself laboriously every day, but this gives her a much more practical method. But why does she need to come to Germany for treatment at all? We have quite a few clinics in Germany that specialize in this treatment, and we have about 60,000 trained therapists. Therefore, the provision is really very good. There's still a lot of room for improvement, but compared with other countries, we're the leading provider of lymphoedema treatments.
Könnte wesentlich besser sein, aber im Vergleich zu den anderen Ländern stehen wir natürlich an oberster Stelle in der Versorgung der Lymphödeme.
Every afternoon, Maria undergoes the so-called apparative intermittent compression. A machine is used to create negative pressure in order to ensure further lymphatic drainage. Maria also has a machine like this at home in Spain, which she has to use every day for the rest of her life. Sport is another important component of treatment. Maria will now be able to perform many exercises at home that she has learned in the clinic. Once all these measures have ensured successful treatment, in other words, after the so-called decongestive phase, the medical supplies retailer is involved. Flat-knit garments known as compression stockings are used to stabilize the success of treatment in the maintenance phase.
Die Flachstickversorgung ist ja
The flat-knit garment consists of a very thick compression garment which forms a stable wall around the affected limb. This prevents the limb volume increasing and also prevents lymphostasis occurring.
in die Extremitäten einfließt.
The first step is to take correct measurements. In order to ensure that each individual patient receives the correct garment, Ms. Wilhelm has to take many things into consideration. It's very important to choose the right time. The patient should have undergone decongestive therapy. There's no point putting a flat-knit garment onto a congested limb. One must also always consider the patient's age, weight, and compliance, and keep the overall treatment concept in mind while trying to provide a suitable garment. A few days later, the stockings are ready. It's time to try them on. In Maria's case, it's a multi-part garment consisting of toe caps, thigh-length stockings, and capri shorts. This has the advantage of allowing her to don and doff the individual elements more easily. Wearing the garments consistently will further improve her body shape and prevent any renewed lymph congestion. Maria's stay has taken her a step further in the right direction. She can see the difference for herself. Yes, I have improved a little bit more. My legs are softer and weigh less. I'm feeling good. It's a positive assessment.
Das Ergebnis ist super.
We've achieved a super result, though of course we do have to say that Maria has looked after herself very well. She's gained a total of 1.2 kilos in weight over the last 8 years, whereby it must be stressed that she didn't put on any body weight as such, but rather that she gained 1.7 liters of fluid in her left leg. That's the only thing. However, we were able to drain off a considerable amount from there, and I hope that now, with additional measures such as Circade products and the medi flat-knit compression stockings, we can maintain this result for years to come. This is a bright outlook, and Maria is looking forward most of all to being back at home with her family in Spain.